Thank you, Madam Chairwoman. I now recognize Rep. Cherfilus-McCormick for 5 minutes.
Thank you, Mr. Chairman. Last year, the USAID announced the Africa Localization Initiative to direct more funding to local organizations in sub-Saharan Africa. As part of its larger localization agenda, the administration has not asked for additional funding to implement this initiative. My first question goes to Assistant Administrator Mayenga. Sorry about the pronunciation. Can you elaborate on the status of implementing this initiative, including potential focus countries?
Thank you very much for that question. So localization is very, very important to the success of USAID's work on the continent, and we are continuing to make progress on that front. We just issued USAID's localization report in March of this year, which shows where we are, and some of our missions on the African continent are doing quite well, but we continue to push and to plan and to implement so we can make even more progress in that end. To that end, we have 12 countries that are now participating, or 12 missions that are participating in the localization, Africa Localization Initiative, and we are working with them to develop their plans and to implement, and we will take lessons from those 12 missions and see what we can do to amplify our localization efforts across the continent.
Thank you. And how is the USAID viewing this program in comparison to the Central America Local Initiative?
We learned a lot from the Central American Initiative, and so we built some of those lessons learned to inform how we are working on the African component of it, obviously contextualized to the African situation. But we work together to share lessons learned and to figure out how we can continue to amplify localization across the agency.
To what extent are you thinking about lessons learned on localization from PEPFAR on the continent?
I would say that those lessons learned have been built into how we are thinking about localization. In fact, our health sector had the highest percentage of localization of all of our programming. And so it's a very good place for us to start in terms of figuring out how we embed those lessons learned to our future efforts.
And I wanted to ask specific questions about health. What are the administration's priorities regarding PEPFAR programming in Africa as Congress considers the potential reauthorization of the program this year?
So PEPFAR has been, if not the most transformative health program in the world. Its impact on the continent has been absolutely changing and transformative, starting out in 20 years ago when very few Africans had access to life-saving medications, to today where we have 18 million Africans who are able to access medications. We have a number of countries that have really made a lot of progress. We have reduced maternal deaths on the continent. We have improved the number of children who are born HIV/AIDS-free. We have made significant progress in terms of addressing the malaria. So a lot of achievements on the African continent, but we still have a lot of work to do. And so as we look to 2030, when we are looking to get to the 95-95-95 formula that has been put out there for HIV/AIDS, it's critically important that we continue to support those efforts, because our inability to support those efforts will mean losing the gains that we have made over the last few years. And so that's critically important. The second area in terms of the president's budget has to do with enhancing pandemic support, the response to pandemics. And so building that capacity, as we saw with COVID, that is critically important that we continue to build those capacities, because it impacts not just Africa, but the rest of the world as well. So there's a lot of work to do, and that request is fundamentally important to the success of our engagement with the continent.
The FY 2024 request would reduce funding for water and sanitation programs by nearly 50% from 2022 levels. Though cholera and other waterborne illnesses remain a threat in the region, what is the reason behind that proposed decrease?
I think it's So it's looking broadly at all of the issues and challenges that we are facing on the continent. And it's also looking at the opportunities that we have to leverage other programs to achieve work in certain areas. So it's that shift of resources to still remain committed to the continent, still remain committed to the health area, but also looking at areas where we can continue to do the work that doesn't undermine our overall objectives in that sector. I think that's one. I think the second area for us, and the administrator has been very strong on this, is figuring out how we crowd in resources from other partners to enable us to continue doing the work that we need to do in these other areas. So those are two prongs that we would be pursuing.
Thank you for your testimony. Mr. Chairman, I yield back.